Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and good afternoon, everyone. Today we're reporting one new case of COVID-19. The new case is the Northern Zone and is under investigation by Public Health. Since our last briefing, there have been 12 new cases announced, and we currently have 16 active cases. And Dr. Strang now will provide more detail.
Thank you, Premier. Good afternoon, everybody. I'll start today, as I always do, by giving an update on our cases here in Nova Scotia. As you may have seen in today's release, we don't have complete data to report at this point. Simply, the lab system is going through a routine update, but we will be posting those cumulative numbers online publicly when they're available. As the Premier said, we are reporting one new case of COVID-19 today. The individual is in Northern Zone, and the case is still under investigation. Several cases that we have reported since our last update are still under investigation. And in particular, we have two groups of individuals where travel is a factor, but where there are a number of potential connects and contacts within those two groups. And so Public Health, the Health Authority, Public Health, is working now to try to confirm the source of the initial infection and identify then within those groups who else may have been exposed. So those investigations are ongoing, but I think it's important to point out that there is nothing at this time that points to general community spread here in Nova Scotia. I know many people are watching the news and seeing COVID-19 case numbers rise here in Canada and in other parts of the world. I know our case numbers have gone up since my last update, and I've been hearing a lot of concern and worry about what that means. While we are focused here in Nova Scotia, I want people to know that my team and I are paying very close attention to what's happening in other provinces and around the world. Many places are reporting record high numbers of new cases right now, and it is very concerning to me and to many of you out there, and we have reason to be concerned. We need to pay attention. I'll just use Manitoba as an example. Until a few weeks ago, Manitoba was on the same track as Nova Scotia. They were reporting low or no cases consistently for a number of months. But things can change in the blink of an eye. Yesterday, Manitoba reported 241 new cases and 5 more deaths, and they are now seeing wide community spread. I use that as an example of how we need to pay careful attention, and we cannot become complacent about COVID. So despite what is going on around us, I do want to assure that in terms of COVID-19, Nova Scotia is still very safe right now. And that is thanks to, in large parts, to all the work that all of Nova Scotians have done to keep ourselves and each other safe. People have worn masks, they practice physical distancing, they have, by and large, kept gathering small, and they've followed all the other public health protocols that are designed to keep ourselves and each other safe. And it's because of these collective efforts that we can safely have our children and young adults in school or university. We can enjoy a meal at a restaurant, visit a local market, see local musicians, or take in a theater performance. We can play or watch sports, go to a yoga or fitness class, take our kids to the park, and join our friends and neighbors in recreational activities and faith ceremonies. However, these all have to be done safely, and there are limitations on gathering limits and close contacts that we still need to follow. But we need to think about, compare ourselves and look around. And unlike in many other parts of the world and in Canada, we can still be doing these things in Nova Scotia, even within the limitations that we have. Many folks around us can no longer do those. So I know we have been at this for a long time. It certainly feels like a long time, and lots of people are tired of all these measures. We are in the 9th month of our response to this pandemic, and there isn't a clear end in sight. And I recognize how hard that is. And I want people to know that I understand that, and I understand that the toll that it is taking on us. And I'm not happy with it either. I don't like having to be like this, but that is the world we are living in. But I also want people to know that I'm committed to doing what's necessary to protect the health and safety of all Nova Scotians. and that we need everyone to be committed to doing that too right now as well. Right now, we need to focus on the next 2 months. The things we do now will have a direct impact on what we'll be able to do safely as we enter the holiday season, and the next few weeks are critically important. So for our collective health and well-being, I encourage and ask all Nova Scotians to keep caring, keep building positive and compassionate communities, and keep using your common sense to be safe every day. We saw lots of this in the last weekend with Halloween, along with lots of creativity. On Saturday night, it made for a safe night for trick-or-treating for children right across the province. I saw in my neighborhood, I went out walking, I saw lots of pictures on social media. There were people handing out candy in creative ways from their doorsteps or their driveways. People laid out individual treat bags or using hockey sticks or chutes. Even people clipping things to clotheslines. And I saw lots of kids having lots of fun. So I want to thank everyone who took that extra time and effort to make Halloween special for kids this year, and to all the kids and families who took their turns, kept their distance, and allowed everybody to have a good time. I even had one little trick-or-treater who contacted me, and I got to use your quote. "I like that I got more treat bags this year. That was really fun. And we went faster, so I got to go to more houses." So we after a long year with COVID, I think there was a lot of pent-up excitement around kids, and it was really great. And I really want to thank everybody for doing it safely and creating an environment where kids could really enjoy that. So thank you. I see this as a reminder that we can still keep our traditions alive while being safe, and we need to think about that as we move into the holiday season. I was also pleased to hear from our enforcement officers that things in general went well at restaurants and licensed establishments this weekend. And I want to thank everyone who was participating, whether they worked there or were there as a customer, who followed the rules. Also thank our enforcement officers who were out there well into the early hours of Sunday morning doing their job. Unfortunately, however, I've heard that there were still some large private gatherings on the weekend that some police had to attend to. And that is, I have to say, that's really disappointing. Especially when the vast majority of people did what they needed to do to keep Halloween safe, that not everybody was taking that same attitude. If our plan in Nova Scotia is going to work, we need everybody to be on board. Not half of us, not 3/4 of us, not just people who are at high risk, but everybody. So we really need to understand we're in a very important and risky time right now, but the way we stay safe is for everybody to understand what they need to do to keep each other safe. We need to respect the physical distancing and masking requirements, and we all need to follow the social gathering limits, even when it's inconvenient. We need to understand that these requirements are here for a very important reason. As we learn more about the virus and where it spreads the most, that is really in groups of people, especially indoors, in a shared airspace often, and especially when they're close together. And that alone is an indication of why that the requirement around masking is even more important as we learn more about how the virus spreads. So that's why I am concerned when I hear reports that of more people not wearing masks when they ought to be. We have to understand that there are some people who do have a legitimate medical reason for not wearing a mask. And when people say that, we do need to respect them and take that at face value. It's okay to remind people politely to wear a mask, and please keep doing that, but we can't be denying people entry into a public space if they say that they're medically exempt. But also, we know that the legitimate medical reasons are a pretty small proportion of the population. So if you can wear a mask, wear one. Do not look for loopholes and don't make false claims. You're putting yourself and everyone else at risk with this kind of self-centered behavior. It's also important that masks are worn properly. I am seeing a lot of people that are not wearing a mask that properly covers both their nose and their mouth. By far the commonest mistake I see is people wearing it down below their nose. The mask has to cover your nose and your mouth. So if you go to our coronavirus website, we have lots of information on, first of all, how to choose a proper mask. If you want to, how to make instructions on there how to make a homemade mask, but also how to wear and use a mask properly. So the individual public health measures like masking, distancing, and washing our hands are one, as you've heard me say before, are one critical piece of our three-pronged approach to COVID-19. Let me touch quickly on the other two. Keeping control at our border, particularly the 2-week quarantine when people arrive in Canada, is the second important component. I recognize that this continues to be tough for people, especially for rotational workers, people wanting to come in and visit loved ones for compassionate reasons. But we do know that maintaining the quarantine works. If we look back over the last few months, almost every case that we have had has been people that related to travel outside of the Atlantic bubble, or people who were expected to potentially be positive because they had lived in the same household here in Nova Scotia. They had known close contact with a travel-related case. And when we look at the public health follow-up of these cases, it's encouraging to see that in almost all cases, the people who were required to be quarantining were quarantining. And as a result, there was few close contacts here in Nova Scotia. So the quarantine does play a very important role. And the third piece of this is really the testing and the public health follow-up. And as you've heard me and the Premier talk about in the last few weeks, we are making that the access to testing easier and faster by allowing people to have access to online self-assessment and now booking tools, as well as building capacity in a number of other ways in the health system. And we're still on target to making sure that we have the adequate surge capacity in our labs, that if necessary, we're close to being able to have up to 2,500 tests per day. And while I'm talking on testing, let me just talk a little bit around the rapid tests, or the point-of-care tests, as they're often reported as. There's certainly lots of discussion about these in the media, and I certainly get lots of questions about why aren't we using these tests, particularly at the border. We are looking at how we use these appropriately, but we have to understand a couple of things about the tests. When they get licensed by Health Canada, that approval is done based on manufacturer data that is obtained under optimal circumstances. Before we can even consider using these tests, they need to be validated in real-world situations. The national lab works with provincial labs, including ours, to do this, and not all rapid tests that have been licensed have actually gone through this validation stage. When you get them into the real world, they don't always perform as the manufacturer would suggest they perform on their optimal type data. The other important thing people need to understand around these tests is that they are less accurate than our current PCR method, especially when we're testing people who are early on in a COVID infection, and even more so when they are asymptomatic. So getting a negative test with one of these rapid tests doesn't actually necessarily mean that people do not have COVID-19. So while it's great that these advances in testing are happening, and that we're continuing to look at how we use those appropriately in Nova Scotia, we have to do that thoughtfully and very carefully, and how they would fit in with all the other public health measures that have been proven to reduce the spread of COVID-19. Let me finish off by talking about Remembrance Day briefly. Next Wednesday is a very important day for all Canadians. It's a chance to recognize the people who fought and often died for our freedom today. It's a chance to remember that despite years of communities being very different and difficult, people remain together and committed. And to me, that's a very important lesson for this year as we're living with COVID. We have provided some guidance for community groups who want to host ceremonies, and this is going to be available very shortly on our website, novascotia.ca/coronavirus. Most of what's in that guidance is going to be familiar, as we've talked about Thanksgiving and Halloween, staying home if you're unwell, respecting gathering limits, wearing masks, making sure you're physically distanced. But there are a few specific things for Remembrance Day as well. If people are going to have an in-person event, we recommend that they make those events by invitation only. Limit the numbers of people that they're inviting. And it's especially important if we're including veterans in there, many of those who would be at high risk from COVID-19, that we provide multiple levels of protection around those individuals. We would also encourage people to think about hosting virtual events, either in place of or in addition to the in-person events. If people are going to be placing wreaths, we recommend that they do that before the ceremony, so to minimize the movement of people during the ceremony, and which allows us to make sure we're maintaining that necessary physical distance. And if people are planning musical performances as part of their ceremony, including our national anthem, we want to make sure that anybody singing is a minimum of 6 feet from anybody else. And this might be, we would also say that this is not a year to have mass singing. We want to have very small numbers of people, if you have them at all, who are singers. So my father, who recently passed away, was a World War II veteran, and so to him and every one of you out there who was or is a member of our military, I want to say a very deep personal thank you. Premier.
Thank you, Dr. Strang, and I too want to associate myself with your remarks. Chrissy, over to you.
We'll do one question and one follow-up in the amount of time that we have allotted for today. First question goes to Tim Biscay with the Halifax Examiner.
Good afternoon. I recognize that the two groups of clusters of new positive cases are still under investigation. But as you've said previously, as the situation worsens outside the bubble, the risk increases for travelers. Is it time to extend the requirement for self-isolation to the household members of people who have traveled as well?
So we're not at that point yet. Where we're saying that what we're seeing is so far when people respect quarantine, that we're not seeing, even though we may have some other household members who test positive, we're not seeing spread beyond that. We continue to look at all our measures and look at our epidemiology, and that is an area that we may have to think about. But you've heard me say before, Tim, that all of this is about finding the balance. Everything we do that restricts has impacts. So if we were to say that right now, then what does that mean for people who have to work in our healthcare system or kids going to school? So I don't believe it's necessary yet, but it's certainly something that we may need to look at down the road.
I'm hearing from teachers that high school students in particular are starting to tire of the restrictions. The teachers tell me that they're able to keep things together in the classroom, but it's breaking down in hallways, lunchrooms, and especially outside. I live near a school and I see hundreds of kids not wearing masks. Is it time to revisit the plan for high schools and perhaps institute a hybrid model where half the students attend at a time?
I don't believe that, our model for schooling is based on what is the risk of bringing COVID into the school. And that risk right now still remains very low. I would say that what we need to do is to really reinvigorate our efforts with those students. I got a complaint to my office today about kids from the local high school going into a local mall and not following any of the rules. That's why I keep messaging that every Nova Scotian, no matter of age, needs to be part of this. That we can't let certain groups off just because they're tired. And so I think how do we work with young people to understand that they may not be concerned about themselves, but they're the ones that are putting other people at risk. Their parents, their grandparents. What about the healthcare worker who then is at risk because and then those young people themselves might need health care. Who in their own group? There's more and more people with underlying chronic conditions, immune suppression, et cetera, that they may not even know about that they're putting at risk. So how do we, rather than changing the structure of schools, how do we make sure those people understand that it's important that they follow the rules like everybody else?
Next question will go to Elizabeth McSheffrey with Global.
Thank you, Dr. Strang. Dr. Tim is now recommending people wear a 3-layer mask up from the 2-layer mask. I wonder if that's something you would consider recommending in Nova Scotia at this point?
We've got instructions on a proper mask. We've talked about that at the Special Advisory Committee. There's maybe some marginal benefit between 2 and 3. I think we've talked about it, and really where we landed was the most important thing is people wearing masks and wearing them properly and not worrying so much about whether it's 2 or 3 layered masks.
Go ahead with your follow-up, Elizabeth.
And I just wanted to touch on an event yesterday at the Atlantic Tennis Center. About 50 people in attendance. Many of them weren't physically distancing, including some politicians. And I just wonder what your message is there, given that police have enforced parties, for example, but we had this public event where there wasn't.
I was sent the picture. I mean, it may be that some of those people who weren't physically distanced were from the same, household bubble or close social bubble, and they don't have to distance. So I think we got to make two things. We got to make sure we don't jump to conclusions just because of a picture, but also it's important to remind if people were not physical distancing when they should have. It's an important reminder. It doesn't matter who you are, whether you're a politician or whether you're or whoever, whether you're a high school student, we all have to follow the rules. So if the things didn't happen as they should have at that ceremony, we need to pay attention to that. And the people running that event, hopefully they're listening to what's been discussed and learning from that.
Next question will go to Brian Flynn with All Nova Scotia.
Dr. Strang, I was wondering if you could elaborate a bit more on the cases under investigation when you're saying that they don't appear to be community spread. I'm wondering if you could elaborate more on what you know and why you don't believe that's a case of community spread.
So what we do know is that that within each of those clusters, there is at least one individual where there's been travel outside the bubble, but there's been other things as we're investigating that could also be sources of exposure, and that we're testing other contacts. More and more, what we're doing now is as we identify a case, we look forward to who they might have exposed. But as we're learning about COVID, it's also equally important to understand, to test people that the case themselves may have been in contact with, to try to understand where that person got exposed. So we're working through both that forward-looking and backward-looking group of contacts to try to, before we can come to a firm conclusion about where these clusters started and then who might have been exposed from there. But everything I've been updated over the weekend and yesterday, even this morning, from my medical officer of health team. Everything we're seeing so far points to that this is not something that's a general community spread here in the province. But until we do our work, I don't want to jump to any conclusions on anything. The fact that we're seeing more and more cases should be put all of us on a higher alert. And to me is why I gave my remarks today. It's a stark reminder that COVID is all around us and is more likely to come into the province. But unless we're doing all those three-pronged approaches, that's what will allow us to limit the impact of COVID by limiting the chance for getting a foothold and having community spread here in the province. I fully expect to get more COVID to come in. We can manage that. What we can't manage is if we get relaxed and we have Nova Scotians who have let down their guard and have some of these super spreader events because somebody hosted a great big party or something like that, which is what's happening in other parts of the province. Again, the way we keep ourselves safe is by all doing what we need to do to minimize the chance for COVID to gain a strong foothold. I can't say that too many times.
Go ahead with your follow-up, Brian.
I don't want you to feel left out. I was wondering if you're okay with that?
I'm not offended anymore.
Okay.
It's a good day for me when you guys don't ask me anything.
I did want to ask you about the fall sitting of the legislature. We haven't received the 30 days notice yet, so I think the earliest date that the legislature could sit would be the 3rd of December, I believe. I'm just wondering, because it's later than usual, there's been a lot of speculation that I'm sure you've heard some of about either there not being a fall sitting or that the fall sitting will be prorogued very quickly and there really won't be much of a fall sitting. I'm just wondering if you could talk about what your plan is and whether you could put to rest some of that speculation as well.
There's always speculation on everything, whether I do it or don't do it. I will have to have a fall sitting. It's legislated. I will, but I'll have more to say about that next week.
Gorman with CBC.
Dr. Strang, the notices that went out regarding the potential exposure at the gym and the gas bar, do those suggest that people who should have been self-isolating were not?
No, that there are people who were, household members who were exposed in living with somebody. They were then out and about. One of the circumstances was somebody who was exempted because of their part of it, their profession, that they're part of the essential movement of people and goods across the province, across our border. So in neither circumstance have there been people who should have been quarantining who weren't. It's just the reality that we have people who are positive who usually it's in there, because when we get a case, we go back the 48 hours before they became symptomatic. And often it's a case of somebody who was in that 48-hour period before they became ill, and they were doing as we all would do, going about our activities as normal. And then when we come across a circumstance that we're not able to contact all the people involved directly, we have to do these public announcements. But it doesn't. Don't jump to the conclusion that that therefore means that there was somebody who should have been quarantining who wasn't.
When you talk about the balancing act, I guess, that you have to do at the same time as you're watching cases increase, not only in our own province but elsewhere, can you talk about the considerations when it comes to easing restrictions like we saw today with access at school gyms? How are you balancing, what you're seeing happening with cases with decisions to ease restrictions in certain cases?
So I wouldn't classify that as an easing of a restriction. We've been working with education since we opened schools, being very careful about there's an important place for allowing access to after-hour access to or community access to schools. What we've been working on is making sure we have the right protocols and the right cleaning staff in place so that our current level of restrictions can actually be maintained when we open the schools beyond those those learning hours, if you will. So I don't see that, frankly, as a loosening of restrictions. It's just it took us some time to get the right things in place to keep the necessary level of safety as we let more community members in a controlled way into the school environment.
Next question will go to Natasha Pace with CTV.
Hi. Just want to be clear, so there's 4 cases that are now still under investigation, right? Can you tell us how many people are isolating in connection with those 4 confirmed cases?
I haven't. That changes as on a regular basis. I don't have those exact numbers because as public health is understanding who was potentially in close contact, they're testing all those individuals. But as we're learning more through the investigation, there's more people moving in and out of that sphere, if you will, as we rule them out or rule them in as contacts.
Does that mean there could potentially be hundreds of people that are isolated?
It's not hundreds, but it's defined clusters. But as we work and as you interview everybody and find out, who was there, there's some people who initially were on the list who actually weren't there, or there's people that weren't on the list. And you find out as you talk to more people, the organizers, whatever, there was another small group of people. So it's constantly kind of in flux, but not large numbers. We're not missing hundreds of people.
I know you spoke briefly about this, but there were 9 people charged over the weekend in Wolfville in connection with Halloween parties. And just wanted to get your message again to Nova Scotians who maybe aren't following the public health orders that have been outlined by government.
Well, I mean, I'll be blunt. They're putting all of us at risk. So stop being selfish. Follow the rules. They're there for a reason. We're working really hard to find a balance to allow people to still have social and other kind of activities, but doing it safely. And when you're not following those rules, you're putting all of us at risk. And we do have enforcement, and we will use enforcement if necessary. But this is the time, and I've said this many times, we need to think about others more than about ourselves.
Next question will go to John McPhee with the Chronicle Herald.
Thank you. Dr. Strang, the province announced today that school gyms would be open to the public. When cases are on the rise, even though here it's not as dramatic as in other provinces, still some might question the timing of that, as it obviously or would appear to raise the risk of infection for students.
No, I don't think it. That's why it's, as I said earlier, that's why we've taken the time to get this, so we have the right protocols in place. That clearly the first priority for our schools is for that educational time. And when we let people in after hours, we have to, so we've got protocols around the limited access, appropriate cleaning after they've been in there, and it's only for athletes and participants or, you know, other officials, whether it's arts or sports, whatever. I know we're going to get complaints, but parents aren't going to be able to go in and watch their kid play. But that's the reality. Would you rather not have it at all, or at least allow your kids to be able to do these events, even if you can't go watch them? It's all about finding the balance. So I don't think, but where we're at right now, I don't believe at all that we're at increasing the risk of the virus being brought into the school environment. What we do know is the main way the virus is transmitted is by people interacting with each other. Not so much around surfaces, et cetera. It doesn't mean we don't have to have appropriate cleaning, et cetera, but that's not the main way it's been transmitted, but we have the appropriate precautions in place, both in terms of cleaning, increased numbers of cleaners to do that work after hours, as well as limitations in who can come into the school for the specific activities that provide the appropriate level of safety. And it's taken some time to work through all that. Always with education, making sure that they were very clear that the first priority is to keep our schools open for kids so they can learn during the day.
Go ahead with your follow-up, John.
Thank you. So we're not talking about pickup games of a group of guys who want to play a basketball game. We're talking about only organized teams will be allowed in. Can you just clarify that?
So I'm sure about pickup. I don't think, but this is really about, because for many, I'll use basketball because I'm with my kids. I'm experienced with this. That in many communities, it's the school where the minor basketball league goes in after hours or on the weekend. Our schools are important opportunities, not just for sports, other ways that groups get together, Cubs, Brownies, arts groups, all those kind of things. So we need to find a way that, if possible, to allow all these things are important for our communities, important for the development of kids, important for people's social, physical, and mental health. So we need to find a way to keep those going, as if we can do it safely, as much as possible. So I believe we have the right protocols in place to now allow that enhanced community access that are actually going to keep our schools. We're not introducing a greater risk into the school, but clearly if we start to see COVID increasing in Nova Scotia, this is on the list, along with a number of other things that we may have to step back from.
We'll now go to the phones to Keith Doucette with the Canadian Press.
Hi, Dr. Strang. I want to go back to travel. It just appears to me that with the epidemiology at this point, it does appear that the major threat to Nova Scotia is through travel. So you've already made your stance clear on that, but I want to put it another way. How close are we to you considering tightening up the travel restrictions that we currently have, given what's happening in other provinces, and given the example of Manitoba, which is a province of comparable size to Nova Scotia that we've seen, who were basically in the same position as us in the summer, and they've just exploded there. It only takes one person, it occurs to me, to not follow the travel protocols, and we could end up with community spread. Could you just comment on that?
So, I mean, this is a continuing point of discussion in certainly my public health team. We allow people to come in for, we have rotational workers coming back. It's important, they're important to our economy. It's important that they're able to participate in their communities when they come back on their days off. We have specialized workers who can come in if the work can't be done by somebody within the Atlantic bubble. And then we have, compassionate reasons. We have many of those where they have a family member who's terminally ill, they come to a funeral. All of those, we have specific protocols in place to minimize the risk, but we continue to look at that and say, because you're absolutely right, as COVID increases in other parts of the country, there is more likelihood of them coming in. But if people follow the protocols we have in place, I think those protocols are very good at minimizing them having opportunities to then spread to large numbers of people here in the province. So but we do continue to look at that. But it's all, as I said earlier, it's all about finding the balance. That the tighter our restriction at the border has significant impacts on families and our economy. So we continue to need to work this dance between COVID restrictions restrictions, but keeping things open as much as possible for our communities and for our economy. And that's going to be a dance that I do with the Premier on discussions in the weeks and months ahead. Because it changes all the time, so we have to find the right approach here in Nova Scotia, finding that balance between competing perspectives, and it's conversations that we have with the Premier's office all the time.
Go ahead with your follow-up, Keith.
Yeah, just to follow up, I wonder if that so-called dance might end based on the investigations you're currently doing with the clusters that we now have.
From what I know so far in that investigation, there is nothing that would point that either of them represent a substantive increase in risk here in Nova Scotia. But my mind has to remain open, and I have to let those investigations come to their conclusion.
Next question will go to Francois with Radio Canada.
Good afternoon, Dr. Strang. You mentioned earlier that the next few weeks will be crucial for what happens during the holiday season. I'm just wondering, how will the situation in other provinces, including elsewhere in the bubble, how will that impact the way Nova Scotia handles the holiday season here?
So that's a point of active discussion right now within government, with the Premier's office, about looking forward to the holiday season. What is the right approach that we can take to the holiday season, knowing that we have to watch it all has to start with the basis of watching the epidemiology and what happens outside of of our province and even within our province in the weeks ahead.
Could we be looking at more travel restriction as we're heading into the holiday season, given the situation that you mentioned Manitoba, Ontario, and Quebec are also in a pretty bad spot?
I'm not going to speculate about where we might land. I mean, as I said, it's a point of active discussion, looking at it from a number of important perspectives.
Next question will go to CBC Jean Laroche.
Hi there. Sorry. Premier, I just wanted to follow up on Brian's question. Why haven't you recalled the House for the fall sitting? This is the latest you've left it since becoming Premier.
Yeah, there's been a few years where I've called the House after Remembrance Day. There's been some where I've held it in September. Much of that had to do with other conflicts in my schedule. So we've been working hard with public health. House leaders have been working to look at what the configuration of the House would look like, and I'll communicate a decision to Nova Scotians, the opposition, soon.
Go ahead with your follow-up, Sean.
As you know, Premier, we're the only legislature in the country not to have sat during the pandemic. That means we're the only province where hundreds of millions of tax dollars have been spent without normal legislative scrutiny, accountability, or debate. Why have you decided that this is the best course of action for this province?
Well, I think if you go back, since you've been here longer than anyone, you would know that the two sessions in the House, there's one in the spring and one in the fall. We had ours in the spring. Met the requirements that we debated a budget. The opposition see no reason to keep us there, so they let us out. As you know, being here, it is the opposition that determines how long we sit. And then we have a requirement for the fall, and we will do that. Everything that we have been doing in terms around the pandemic, we've communicated to Nova Scotians. It's up on websites, and we'll continue to do so.
Next question will go to Pat Healy with the Laker News.
Hello, good afternoon, Dr. Strang. As you may know, many legions and community halls like the LWS Hall host dart tournaments and dart leagues. There's a social media post and an email going around regarding darts and saying that they have to be put on hold. Can you provide some clarity on whether they're allowed to go ahead with dart leagues and dart tournaments or they're not?
So we've got a number of requests from a range of activities: darts, karaoke, pool, video games, etc. So I'm working right now with my colleagues in alcohol and gaming, the food safety inspectors, the public health inspectors, my public health team, trying to provide some clarity around what are the type of activities that can happen and what are the kind of rules that you allow them to happen safely within the kind of licensed establishments. So, there'll be clarity coming really soon on that, Pat.
Go ahead with your follow-up, Pat.
All right, thank you. The follow-up, what's the large number of social gatherings and people not wearing masks, are Nova Scotians getting complacent with the restrictions regarding COVID-19?
So I think we are seeing some signals of people becoming complacent. That's why I spoke to in my remarks. I think it's as the world becomes a bit more concerning around us, whether it's other parts of Canada or internationally, it needs to be a strong reminder to all Nova Scotians that the things we have in place, we can't be relaxed just because we're safe here in Nova Scotia. The way we keep ourselves safe is to all of us follow the public health restrictions and the recommendations. That's how we actually, as I've said earlier today, that's how we minimize the chance of a strong resurgence of COVID. It's how we keep ourselves all keep ourselves safe. So it's critically important that all Nova Scotians continue to practice the things around masking, social distancing, limited social gatherings, etc.
And that's all the time we have for questions today.
Thank you, Christine. I want to take a moment to offer my respect to our veterans. Ceremonies will look very different this year. We won't be able to gather or follow a parade, but I hope veterans and their families will take comfort in knowing that Nova Scotians will find their own way to reflect and remember. And Dr. Strang, I know this will be your first Remembrance Day without your hero, your father, was in another part of the country, and you didn't even have a chance to mourn him the way we normally would, like many Nova Scotians. But I want you to know that you will be in our thoughts as well on Remembrance Day as we remember your family. Well, Dr. Strang has confirmed there are no signs of community spread in our province. I am still concerned about the number of cases of COVID creeping up. And just as Pat is wondering at the Laker, are we becoming complacent? Just because our cases are still lower than most anywhere in the country does not give us the right to ease up on our protocols. COVID is lurking in every corner, and the moment we let our guard down, by not isolating long enough, by ignoring our symptoms, or by not getting tested when we are sick, COVID pounces and cases climb. We are heading into the flu season. Winter is coming, which will force us indoors. I know we're tired. We're coming into the 9th month of dealing with COVID. I understand you're fed up, but we can't let our guard down. Early on, we enforced the public health protocols, mandatory masks, distancing, good hand hygiene, household bubbles, and it worked. Our cases, for the most part, have been contained. But it only works, as Dr. Strang said, when we all are working together to keep each other safe by continuing to follow these protocols. And if we don't, just look around the country or look across the border. The evidence is clear. There's a reason cases are on the rise. COVID likes when you don't wear a mask. COVID likes when you gather in groups. COVID likes to be ignored because then it finds a way in. And once it's in, it is hard to get out. So let's remain diligent and do our best to keep COVID contained and slowed from spreading.